All right, we are back now with an incredibly wonderful resource to tell you about. For decades, Child and Family Agency of Southeastern Connecticut has provided all sorts of services to families in need.
And this includes high-quality medical and mental health care, an urgent crisis center for children and teens, and much more. Here to tell us more is CFA CEO Lisa Otto and Director of Medical Services Jessica Chan. Thank you so much both for being here this afternoon.
Thank you for having us.
1972. Give yourselves a round of applause. That is so wonderful, right?
It's a lot of years. We're past our 50th anniversary.
Isn't that remarkable? I mean, you've been helping so many people. You got a round of applause. We can hear it now. Tell us what your mission is at CFA.
Yeah. Our mission is to advance individual and community health throughout Windham County, New London County, and Middlesex County.
And how are you doing that and achieving that?
Yeah. So there are 5 major areas that we deliver services in. One of them is childhood services, which includes things like child care and family resource centers. Another is mental health, and that's mental health that we deliver in clinics. We go out into the community and deliver mental health care in people's homes, and we deliver it in the schools.
Wow.
The next is medical services. Then we have, as you guys mentioned, the Urgent Crisis Center, so that we're there for children and youth when they need us the most, when their crisis is really acute. And then we also have safety net services, partnering with families that are really at risk of being separated due to some of the struggles they're experiencing.
Do you think there's a pandemic out there with mental health with children? And
yeah. Absolutely, there is, and this was going on pre-COVID, but we've certainly seen an increase since COVID, and there's just a lack of resources out there as well, and so we've really expanded quite a bit over the past few years too. For our school-based services, we're now in 20 schools across New London County.
Wow.
So in these schools, we have medical providers and mental health clinicians. So we're functioning like little pediatric offices in the schools. We're doing physicals, vaccines, acute visits, seeing kids for chronic illnesses. And we also do a lot of mental health screening. So we're picking up on most of the kids who walk through our doors, especially kids 12 and up, screening them for any anxiety, depression, and then working collaboratively with our mental health providers to get those kids into therapy services.
Can you paint a picture to, show us and also for the viewers, like what would happen if you were not in those 20 schools right now with what you're doing?
That's a great question. A lot of these families wouldn't access services. So that's one of the biggest pushes of school-based is accessibility and providing equitable quality care. So we're seeing these families regardless of their insurance status. We're seeing them when they have lack of transportation. A family member, a caregiver can't get out of work to get their kid to an appointment. We're seeing them. We've seen almost 4,000 kids so far this school year for over 22,000 visits.
Wow.
So that's 22,000 times that a kid could be taken out of school for a medical or a therapy appointment. And we've been able to serve them right there during the school day, get them back to class, working collaboratively with the school staff to make sure that they're healthy, they're ready to learn. We know kids with physical ailments, with mental health conditions, they're not available to learn. They might be physically at school, but they're not comprehending, they're not retaining information. We're there to help.
How do people get in touch with you? How do we access you?
So our website is ctcfa.org, and you can find all the information you need about how to contact us there. We also have a phone number, 860-437-4550. People can call us, and we have people who answer the phone who are happy to listen and understand what service we have that would best meet a family's needs.
That's great. So they can kind of gauge, if this would be a good fit for them.
Exactly, exactly. And where we are in regard to an individual family, what we have that would be the most accessible, the most convenient, that their insurance would be a match for, that they can get to.
Great.
In our last 10 seconds, mental health just as important as physical health?
Absolutely.
Yeah.
Absolutely.
Right? I think it's wonderful. You guys are doing a great job.
What an amazing resource here in our community. So thank you so much.
Here's to another 50+ years.
I know.
Helping people.
Much.
It's so good to see you guys.
Thank
you
you.
would like to learn more about the Child and Family Agency of Southeastern Connecticut and the services that they provide, please visit childandfamilyagency.org. Thank you guys again so much.
Great
We so
stuff.
appreciate your time.
All right, still ahead, we are visiting an incredible urban farming spot in Hartford's North End that's getting fresh and nutritious food right into the hands of people who really need it.